Once you have done the correct diagnosis, going through the differentials, and you have jotted down the definitive diagnosis, you can move on with the treatment guidelines or the treatment plans devised for the patient. The initial management of an unconscious patient would be to stabilize the patient. So you would be assessing the airway, you would be assessing the breathing, and you would stabilize and confirm the circulation is maintained for the individual. Immobilize the cervical spine if trauma is suspected. So this is the foremost guideline for the traumatic patients as well. Calculate the Glasgow-Coma scale score, check blood glucose, check pupil size and reactivity. If hypoglycemia, treat with IV glucose. If evidence of opioid toxicity, treat with IV naloxone. Obtain collateral and bystander history, as well as usually this bystander history is more important for patients of road traffic accidents. Perform detailed physical examination and perform initial investigations accordingly. Move on with the initial supportive care, including the critical care if appropriate, and initiate specific therapy if it is already diagnosed what the patient is suffering from. You have to confirm or strongly the clinical suspicions have to be confirmed first of all for the empirical treatment to be done for the patients. If the diagnosis is unclear or clinical evidence of acute structural neurological event, perform the CT scan of the head as soon as possible. And if the diagnosis is likely to be due to diffuse physiological brain dysfunction, metabolic disorder, or psychiatric origin of the symptoms is found in the patient, the treatment of the presumed cause is very important over here, because the underlying cause has to be treated first of all. And if there is no further improvement even in this particular case, then you're going to perform the CTs or the MRIs for the particular individual. So the treatment of the comatose patient would start off by correcting the hypotension. We would be correcting the hypoglycemia, hypercalcemia, hypoxia, hypercapnia, and hypothermia rapidly for the individual. So this would be the emergency guideline for the individual as you would go on with the protocol. Oropharyngeal airway is maintained. Tracheal intubation is done if required for the individual, and we would move on with the mechanical ventilation. So we would basically evaluate if the patient needs the mechanical ventilation or not. Passing the IV bore cannulas is very crucial at this point, and you would start off with the therapy of naloxone and dextrose if narcotic overdose is basically suspected in the individual, or hypoglycemia. Thiamine with glucose in malnourished individuals. We can basically start off with IV heparin, or even a thrombolytic agent if you're suspecting that the patient is suffering from cerebral hemorrhage. Physostigmine in anticholinergic type drug overdose. We would resort to benzodiazepine antagonists after the overdose of soporific drugs and hepatic encephalopathy. So these metabolic disturbances can result in a particular state, and this would be the treatment of choice. Specific treatments are basically devised for specific drugs, drug overdoses, or even the specific states. If they are diagnosed in a particular way, you're going to devise the treatment accordingly for the individuals. Fomepizole for ethylene glycol ingestion. So it would be depending upon the type of drug which was ingested, and that is basically resulting in a kind of an intoxicated state in the individual. Hypotonic intravenous solutions are also devised for some of the patients. So it would be basically depending upon the type of definitive diagnosis that has been made after a detailed history, after a complete physical examination, neurological examination, and obviously coupling up all of this evidence along with the lab investigations and the radio imaging techniques. And that is going to help you a lot in devising a proper treatment and management guidelines for these particular patients.